we obviously have a concerted effort to ensure that the community has access to the best available information about COVID treatments, about COVID vaccination. Part of that is certainly keeping monitoring for misinformation and countering that information. Also taking action such as blocking certain commentators from our own channels or recommending other agencies, government agencies do that, and reporting various accounts to the social media platforms who have been, worked with us very closely over the last few years to make sure that that they're quite responsive to reports of information against the standards that they each have set out for information on their platform. So we're very active in that, and we liaise with other agencies to identify those sort of sources. The main topics of misinformation continue to be that vaccines are in some way harmful or that they don't work, are probably the headlines. There is still also a reasonable thread of suggestion that COVID-19 does not exist or is not a severe illness, are probably the main topics.
Okay, so how do you handle that in circumstances? I think if a member of the public is doing it, you might shut down the platform by which they are communicating. If it's an MP or if it's a doctor?
Regardless of who it is, if we're concerned that they're promoting information that we know not to be correct through our channels, we will shut that down. We have a protocol about, and it's published on each of our channels, about our expected standards, and it includes statements about misinformation. It explains what we'll do. So we will contact them, we'll remove the specific comments initially and contact them and explain. But if there's repeated cases, we will actually block that person from our channels. And similarly, we will report them to the platform if we're concerned about information that they're publishing through their own sort of accounts, not through ours.
Authorised G. Rennick, LNP Chermside.